Nurses at St. Mary's and St. Joseph's hospitals in Tucson voted overwhelmingly to unionize. It affects about 700 nurses. Vanessa Barchfield reports on how that decision came about and what that means in a state with historically low union membership.
Fawn Slade is a nurse on the orthopedic floor at St. Joe's. She says the efforts to organize started in September when some union reps came to talk with her and her colleagues at the two Tucson hospitals.
And so we met with union organizers, had a couple meetings, felt that this could be a positive change for us here at St. Joseph's, and moved forward from there.
Close to 75% of the nurses at both St. Joe's and St. Mary's voted to join the National Nurses Organizing Committee, National Nurses United. Slade says for her, the decision was an easy one.
Because it allows nurses to have their voices heard, to bargain together with leadership to be sure that our patients are advocated for effectively.
One of the issues in the nursing unions is patient care, and that gets to patient ratios, how many patients per nurse. And so as a collective bargaining agreement, you can raise that number so there are more nurses per patient. And that usually translates into better patient care.
Arizona has one of the lowest union memberships in the country. Has that always been the case, and what are some reasons for that?
Part of it is just the industries that are here. You have mining, which is a unionized workforce oftentimes, and then you have some of the resorts and entertainment in that area that are often unionized in terms of the workers there. But when we think of unions in this country, we think of the car manufacturers and big industry. And Arizona just doesn't have a lot of big industry, and I think so as a result, unions haven't been here as strongly as in some other states.
Arizona is also a right-to-work state.
So right-to-work state, what that means is that the employer cannot force or enter into an agreement with a union to say we'll only hire union workers. And similarly, unions can't force all of the employees to pay union dues. And that's what right-to-work means. And that's set out in the Arizona Constitution.
Slade says that raised some questions.
That was a pretty big concern of how does a union work in a right-to-work state.
With this union going into place in both St. Joe's and St. Mary's, the employees will have to voluntarily decide whether or not they're going to pay the union dues, even though they're always going to get the benefits of the union contract.
There are 27 right-to-work states across the country.
In those states, we have found that worker benefits have been lower, workers' health have been lower. In fact, in those states, you are 47% more likely, if you're under the age of 65, to not have health insurance. And so, again, this is an opportunity for us to band together and to look at our patients and as well as our community and say this is a positive change. This is a change that will positively influence not only the staff members here at our facility, but our community as a whole.
The union vote at these two hospitals passed pretty easily. What are some arguments against unionizing?
With a union, it's much harder for people to be let go or disciplined because everything is based on what is in the collective bargaining agreement, which is just, it's called a CBA, and that's a contract. And so one thing is it's hard to get rid of people who aren't doing as good of a job because you have to follow all the procedures to find cause for termination, as opposed to in Arizona, as you may recall, we're an at-will state and employees can be terminated with or without cause. There's also the issue of people who are really good employees maybe aren't going to get as big of pay raises as they would in a more competitive workforce, because usually pay raises in that are set and standardized based on seniority.
And do you expect that other nurses at other hospitals in Tucson might decide to organize after seeing the example at St. Joe's and St. Mary's?
I think certainly once a union comes into an industry within a location, such as in Tucson here, they start talking and they start saying what's going on there, what are your things, what are your wages, what are your hours. The success of that union, if they're successful at St. Joe's and St. Mary's, I think you'll see the attempt to spread other places. If they have problems and they're not successful, obviously then that'll answer what happens with the other hospitals.
I certainly think we've set a precedent that this can be successful and that it can be successful here in Tucson, Arizona.
Nurses at St. Mary's and St. Joseph's will now elect leadership, then start contract negotiations with hospital administration. In a statement, the hospital's parent company, Tenet Healthcare, said it respects their decision to unionize and it will work to reach a collective bargaining agreement that benefits both groups.